My presentation today is about women and obesity, what lies beneath. And when we go back to 1905, سنة 1905, obesity was seen as a figure of beauty. يعني كان المنظر اللي هو فيه جمال هو الناس اللي عندها overweight and obesity. While in 2015 110 سنة بعدها ابتدت ال WHO تقول إن there is 2.3 billion adults are having overweight and at least 700 million adults were obese, and the majority of these 700 million are females. This is a percentage of obesity and overweight in different countries in the region. And we can find here's a percentage in different countries. And when we come to Egypt, we find that there is 33% of females are having overweight and 46% of the females are obese. This is another study in 36 countries in the region in women age 20 to 49. These countries are developing countries. And in this study, Egypt has the lowest percentage of low weight or underweight beyond these females, and the highest percentage of overweight and obesity. أقل percentage للunderweight in Egypt، وأكتر percentage للoverweight موجودة برضو in Egypt في الاستادي اللي اتعملت على 36 developing countries in the region. Obesogenic environment is very special for females due to urbanization, sedentary lifestyle, private cars, television, less physical activity, and more help in the house with appliances. There is high caloric and fat intake. Women are more likely to be overweight due to cultural effects. And when we come to lifestyle of Egyptians, we can find that the percentage who eat 5 or more servings of fruits and vegetables among females is 20%. And those who do physical activity, regular physical activity in females are less than 57% of the females, and they don't do even the lowest level of activity. These are the complications of obesity, the clear and the present danger. Obesity can lead to cardiovascular disease, coronary artery disease, angina, myocardial infarction, heart failure, arrhythmia, and sudden death, and hypertension. And for every 10% increase in body weight, there is increased 6 millimeter mercury in the average blood pressure, and decreasing body weight lead to decreased blood pressure. Deep venous thrombosis, respiratory complications in the form of sleep apnea, which is a serious complication of obesity, and impaired respiratory functions, and Pickwickian syndrome. And Pickwickian syndrome is a special character in one of the Charles Dickens, the famous writer, Charles Dickens novels, كتاب ألفه تشارلز ديكنز شهير جدا، طلع فيه كاركتر البيكويكن أو مستر بيكويكن اللي هو شخص الأوبيس عنده abdominal obesity وعنده طبعا respiratory distress، وكان بينام وهو قاعد، وده كانت كاركتر وصفها تشارلز ديكنز. الصورة الثانية الحقيقة اللي موجودة هنا هي the case of sleep apnea, and sleep apnea can be dangerous, and sleep apnea can be reversed with treatment of obesity. Another group of complications of obesity, hepatobiliary disease, fatty liver, non-alcoholic steatohepatitis, or the new term muffled, calcular cholecystitis, arthritis, especially of the weight-bearing joints like the knees and pelvis, cancers in the form of breast cancer, colonic, prostate, uterus, ovarian, diabetes mellitus. 80% of diabetics, especially type 2, are obese. Hyperlipidemia, especially hypertriglyceridemia, infertility, abortions, birth defects in obese women above 30 body mass index. There's increased mortality above 30 body mass index due to different reasons. This is a relation between body mass index and some chronic diseases in males and females, and we can find that type 2 diabetes, cholelithiasis, hypertension, and coronary artery disease is increased in both males and females, and especially diabetes. We can find that diabetes is the most important comorbidity with obesity. This is also showing the relationship between body mass index and the risk of type 2 diabetes, and we can find that females with body mass index above 35 are 93 times, having 93 times increased incidence of type 2 diabetes when compared to females with body mass index less than 22. Obesity is linked to 9 types of cancer. Some of them are for females, and some are for both females and males, or even for males only. Breast cancer, colonic cancer, uterine cancer, gallbladder, ovarian, prostate, upper GIT, pancreas, renal cell carcinoma. These are some other types of complications in obesity, which are the physical complications and the social complications. And the physical complications include tiredness, breathlessness, varicose veins, headache, edema and cellulitis, sweating, intertigo, stress incontinence. And the social complications include a sense of isolation, unemployment, family or marital stresses and problems, financial problems, and depression. We come now to a certain type of obesity, which is abdominal obesity. What is the relation of abdominal obesity and cardiometabolic risk? And this was shown in the HOPE study, that abdominal obesity increased the risk of cardiovascular events. Another trial here, the Paris prospective study, predicting adverse outcome such as sudden death in patients with abdominal obesity, and abdominal diameter is a better predictor of risk of sudden death than BMI. This was shown in the Paris prospective study. This young lady, a nice and slim lady before marriage, and we can see our culture, in our culture 10 years after marriage, most of the females are becoming obese. There is twin epidemic of obesity and type 2 diabetes, and it is on the rise. يعني في كل ما بيزيد الابيديميك of obesity كل ما بيزيد الابيديميك of type 2 diabetes. وعندنا ارقام الحقيقه خطيره جدا. From 1986 to 2000 the prevalence of BMI 30 is doubled مرتين. Body mass index above 40 quadrupled، يعني زادت 4 مرات الانسيدنس of BMI أكثر من 40. Extreme obesity of body mass index more than 50 is increased 5-fold 5 مرات. This is alarming. Increasing prevalence of obesity among children suggesting that the epidemic will worsen. يعني كل ما احنا شايفين ان احنا اطفالنا obese كل ما احنا عارفين ان الفيوتشر هيبقى more obesity, more complications. In morbid obese population, the life expectancy is reduced 9 years in females and 12 years in males. Women and obesity is more than an issue of size. يعني مش مجرد شكل ومش مجرد ان بنوته عايزه مثلا تلبس حاجه على مزاجها. We need to change the priority physicians give to obese women. يعني لازم نقول ان obesity ده is a chronic disease and it has serious complications according to the definition of different associations. يعني WHO, European associations, American associations كلها بتقول ان obesity is a chronic disease and should be managed because it leads to several complications. It's more than an issue of size. There is greater health consequences, greater physiological or psychological consequences, and there is specific female issues like fertility problems, polycystic ovary syndrome, pregnancy complication, influence on fetal development, complications related to menopause, and female cancers. It is a lifestyle of medical risk in females, starting with infancy, then adulthood, adolescence, adulthood, young adults, female reproductive period, older females, and geriatric females. In adolescence, coming to adulthood, obesity may reflect psychological problems and reproductive problems. I'm going to talk about fertility and assisted reproduction. Fertility with assisted reproduction in case of infertility, it is less successful in the presence of obesity, and the probability of pregnancy with assisted reproduction is reduced in case of pregnancy, at least 50% reduction in the chance of these females to get pregnant. Body mass index also predict infertility in cases of polycystic ovary, with or without polycystic ovary. The presence of infertility is increased with the increase of body mass index. During pregnancy, there is certain complications in early pregnancy. There may be miscarriage and twinning due to obesity, and there is technical complications due to difficult ultrasound, antenatal complications, pregnancy-induced hypertension, preeclampsia, gestational diabetes, and venous thromboembolism, intrapartum, higher rate of induction of labor, planned and acute cesarean section, assisted delivery, and vaginal tears, postpartum hemorrhage, infection, venous thromboembolism are increased in the presence of obesity. Operative complication, higher rate of cesarean section, infection, bleeding, thrombosis, and anesthesia complication. Fetal complications, macrosomia, congenital anomalies, fetal distress, perinatal morbidity and mortality, and birth injury. Gestational diabetes, it occurs in 4% of all pregnancies, and especially in overweight women are having 17% risk of gestational diabetes. And the risk estimate for type 2 diabetes after gestational diabetes range from 17 to 63% over 5 to 16 years. There is intergeneration effect of uterine development from during pregnancy metabolic effects to the effect of pregnancy on offsprings of obese females. In mature and aging women, there is increased risk of obesity-related comorbidities with aging, like type 2 diabetes, hypertension, cardiovascular disease, and increased risk of all types of cancers, especially uterine cancer, kidney cancer, breast cancer, and cervical cancer. This is obesity-associated increased risk of most cancers, and we can find in females that uterine cancer is increased 6 times in obese females, and cancer cervix increased 3 times in obese females, and cancer breast increased 2 times in case of obese females. Obesity in older women, there is increased risk of cognitive dysfunction and dementia with aging, with negative implication on life expectancy. There is increased risk of Alzheimer's disease in elderly females with metabolic syndrome. This was not shown in males with metabolic syndrome. Obesity is an independent risk factor for Alzheimer's disease, and it is associated with increased risk for dementia and Alzheimer's disease. Then we come to the end with this a figure showing different complications in females with obesity. In reproduction, there is effect on reproductive health in adulthood, psychological problems, chronic disease for mature and aging women, the possibility of increased risk of cancers, cardiovascular disease, and in elderly women, decreased life expectancy and cognition disorders. هناك دايما امل، يعني احنا لما نشوف يعني الممثله الشهيره دي يعني during obesity and after treatment of obesity بيبقى دايما عندنا امل ان احنا نقدر نوصل لوزن كويس. وبرده عندنا الصوره دي برده لاحدى الفنانات before and after obesity treatment, and there are many modalities to treat obesity, and maybe there is short of time ما اقدرش اتكلم عليهم النهارده، ولكن انا بشكر حضراتكم.